as I said, I'm Laura Starr. I'm the Director of External Affairs. And so my role at Community Health is really relationships, all of the relationships that we have with folks coming from outside the clinic. So that includes our donors, it includes our community partners, it includes civic leaders, it also includes our patients, current and prospective. And so my team works on all of these different components to make sure that we are really being good members of our community. So to that end, I want to share with you all a few things. There have been quite a lot of external things in the past year that have been influencing your roles at Community Health and the way Community Health is operating within our community. So I just wanted to I'm going to give a very brief overview of a whole lot of things, but welcome folks to ask questions and follow up with me if there's more you want to know. So just tonight, the first section is the insurance landscape. So as you all know, for 30 years, we've been serving the uninsured. Over the past year, we have also expanded that to include the underinsured, but that is specific to a couple of policies that I'm going to talk about here. But before I get into those policies, we're in a new period right now. In 2020, when COVID hit, a public health emergency was declared, and something that had traditionally happened every single year was put on pause. And that is folks who had a Medicaid policy were required every year to redetermine their eligibility by submitting some paperwork. They get a letter in the mail, they fill out specific forms, all of these things. That redetermination process was put completely on hold from 2020 until May of this year. So that was just reinstated, and Illinois already had a history of being a state where many people fell off the Medicaid rolls every year. This year was really no different. Over 200,000 residents of the state of Illinois lost coverage over this summer. And one of the things that Community Health has been doing, because when people are between coverage, they can come to us, we can serve them, but we have also been helping them get enrolled by connecting them with some of our partners who have navigators doing enrollment and helping people get back on their insurance policies if possible, if they just lost coverage because they didn't get their paperwork in time or something like that. Some people truly are no longer eligible because their income has changed or some other circumstances. But I mentioned before two particular new policies. So there are two state-funded insurance policies. These are Medicaid-like, but they're not actual Medicaid because they're not funded by the federal government. These are state-funded policies that were introduced in 2020 and 2021, respectively, and health benefits for immigrant seniors and health benefit for immigrant adults. As I said, they're state-funded and they specifically target undocumented residents of the state of Illinois. This is awesome news that some of our undocumented residents have been able to access insurance for the first time. And we have been, since this started in 2020, encouraging our patients who are eligible to sign up. These folks are experiencing Medicaid redetermination for the first time ever because Medicaid redetermination did not exist when their policies were introduced. And so this is the population, the population that Community Health is currently seeing who might be most directly impacted by this. However, people will not be added to those roles because this year, the state of Illinois paused enrollment for both of those programs. There is the possibility that enrollment could be reopened in the future, but given the skyrocketing costs of the program for the state of Illinois, it doesn't seem extremely likely in the near future, at least. So currently, no one can enroll in these HBIA and HBIS policies, but people who have them can continue to use them. And we continue to see these patients. We don't bill, as we always have never billed. The only way that that impacts some of you in your roles is that from these patients, we have to send them to a retail pharmacy to pick up their prescriptions. We can write those prescriptions. They can pick them up outside of community health. And if they get referred to a hospital for a test or some other service, that we do referrals for, the hospital and those pharmacies outside of community health will bill their insurance, but currently there are still no costs for those patients. There might be copays down the road, but we don't know yet at this point. And really, all of this continues to change. And so the best thing I can tell all of you is that we do see a very small number of patients who have this coverage. We hope to continue to do so. And as things adapt and change, we will make sure to keep you all informed so that you can inform your patients as well, or answer any questions that they may have if they come to you, or know where to go, where to send them to get those answers. So we're continuing to watch the news, and we'll keep you informed as we get more informed. We go to the next slide, please, Katie. Thank you. So as Steph mentioned, we have been very involved, changing subjects a little bit here. We've been very involved with responding to the migrant crisis in the state of Chicago, or in the city of Chicago. I'm sure you all are very aware, over the past year, we've had more than 20,000 asylum seekers, mostly from Venezuela, arriving in Chicago from border cities. They've been coming on buses, they've been coming on planes, sometimes as many as 14 buses in one day. So those arrivals are happening really fast, have been happening really fast and furious. And in May, when the numbers started to creep up pretty quickly, the city of Chicago reached out to us. They were at that time using a loophole with it, where police precincts are warming centers that can temporarily house people, using that to house people in what they're calling now staging areas in police precincts and in airports until people can be placed in shelters. The city's been opening shelters as quickly as they possibly can. There are currently 25 new shelters open in the city of Chicago, and they continue to open more and move people as quickly as they can, but there are still several thousand people in these staging areas, which are police precincts and airport areas. When that happens, when folks are getting into shelters, there's a whole range of resources that are being directed to them by the city, the county, and a number of other organizations. But until they get into those shelters, when they're in the staging areas, the resources are difficult to come by and are mostly being provided by volunteers. And that's where we stepped in. So the city of Chicago asked us if we could help provide some healthcare to these folks in police precincts. So we did that. We spent 14 weeks where we were out every single week in the police precincts. Many of you on the call today were out literally on the sidewalk, as you can see in this picture, with our rolling suitcase full of medical supplies and a couple of folding tables, doing health screenings, doing a number of point of care tests, and frequently enrolling these people as new patients with us and scheduling them for follow-up appointments in clinic where they could access a wide range of services. There were so many of these follow-up appointments that we were scheduling, and then that we started to see a little bit of a wait start to build up. And then that was compounded by the fact that the follow-up appointments were not only coming from us, but they also started to come in from other mobile health providers who were doing the same work that we were doing. They were also in the precincts and in the airports seeing individuals who needed follow-up care beyond the screenings that they could provide on the sidewalk. And we were one of the only providers who was accepting these patients and accepting them quickly. So in order to make sure to keep our wait times reasonable for people who are in a very transitional period of their lives. We suspended our mobile health unit at the end of August and refocused our efforts on providing those new patient appointments and really streamlining a referral process for the other mobile health providers to continue sending those follow-up appointments to us. We have had now, just since last May, more than 500 new patients registered from our migrant care efforts. And the most recent new development is that just last weekend, we did our first flu and COVID vaccine clinic in one of the precincts. We have 3 more of those scheduled over the next several weeks, but we're continuing to stay very involved with this population, primarily in our clinic, but we're staying very connected to the other mobile health providers and to the city, and all of the folks that are working directly with them on the street to make sure that they can get access to the best medical home we can provide. And then finally, community building and advocacy. So we've been doing a ton of, my role in external affairs has only existed for about 1.5 years now, I think. So this is something that has been really, that we've really been investing in, as Steph was talking about in our strategic plan, is making sure we're out in the community. So that has meant building relationships with legislators. We've been working both with local and with state and federal legislators, all 3 levels, to try to make sure that free and charitable clinics are at the table in these conversations. We are advocating for free and charitable clinics, and in fact, have now for 2 years in a row been part of a coalition with the Illinois Association of Free and Charitable Clinics to fund the clinics from the state of Illinois. This is the first time that this has ever happened. And it's a huge testament to the work that we're doing and to the state's belief in the value of free and charitable clinics and the safety net. We've been building partnerships in migrant response, which means from the city of Chicago, we've been working with the mayor's office, with the Chicago Department of Public Health, and with the Office of Emergency Management. Every week, we've been on calls with these folks all since last May. And then we're also participating in a lot of community convenings, just a few of them here. There's a coalition called the Welcome to Illinois Coalition. We've been working with Partners in Health. We have participated in a number of different Healthy Chicago Equity Zones. We're part of several of them because of our clinics in multiple parts of the city. And then we also participate in a number of community advisory councils all over the city. So we're trying to make sure that we are staying tuned in to the experiences of our patients all throughout the city of Chicago. So that's it for me. And I look forward to hearing questions or anything like that. But thank you all for giving me some time to share what's been going on outside our 4 walls.